Caring for babies requires a specific set of considerations due to their fragility and dependency. Here are 15 essential ways to care for babies. Feeding. Whether breastfeeding or formula feeding, ensure the baby is fed on time. Breastfeeding offers various benefits, but whatever the choice, prioritize the baby's feeding needs. Burping. After feeding, gently pat or rub the baby's back to help release gas bubbles that might cause discomfort. Diaper changes. Regularly change diapers to prevent rashes and keep the baby comfortable. Use gentle wipes and apply diaper rash cream when necessary. Bathing. Be gentle during baby baths and use mild, baby-specific soaps. Ensure water temperature is warm and test it to avoid scalding. Clothing. Dress babies in comfortable, soft clothes appropriate for the temperature. Ensure they aren't too hot or cold. Support their head. Always support a newborn's head and neck as they can't control it themselves. Sleeping. Place babies on their backs to sleep to reduce the risk of sudden infant death syndrome, SIDS. Use a firm mattress and avoid loose bedding or soft objects in the crib. Bonding and affection. Show love and affection through cuddles, gentle touches, and talking to the baby. This helps in emotional development. Regular doctor visits. Schedule regular checkups and vaccinations. Follow the doctor's recommendations for the baby's health. Safety measures. Ensure a safe environment by baby-proofing the home, securing furniture, and keeping small objects out of reach. Stimulation and play. Engage babies in age-appropriate activities to stimulate their senses, such as talking, singing, and using toys that encourage sensory development. Comfort and soothing. Address the baby's cries by checking for signs of hunger, discomfort, or sleepiness. Rocking, swaddling, or using a pacifier might help soothe them. Regular interaction. Communicate with the baby by making eye contact, talking, and responding to their cues. This fosters emotional bonding and language development. Tummy time. Allow babies some supervised time on their stomachs when they're awake and alert. This helps develop their neck, shoulder, and arm muscles. Self-care for parents. Take care of yourself. Rest when the baby rests, eat healthily, and ask for help or support when needed. A well-supported parent is better equipped to care for a baby. Remember, every baby is unique, so these tips can be adjusted to suit the specific needs of the individual child. Be patient and attentive to your baby's cues, and seek advice or guidance from healthcare professionals if you have any concerns.